Hello everyone, welcome to Wellness Wednesday. Lindsey the pharmacist here, Wellness PharmD Consulting. And this week's topic has been brought up by a topic from 2 weeks ago when we started to cover a brief overview of hormones in your body. And it brought up questions about birth control. And is birth control good or bad? And should I take birth control or not? Or what birth control is right for me? And it's not really that simple. Birth control is good and bad, and it just depends on the individual. So like almost everything here at Wellness PharmD, we want to take a look at you as an individual. If you have underlying conditions, if you have PCOS, endometriosis, if you, or maybe you're like me and you have a BRCA gene, so you're more prone to reproductive cancers, or you have osteopenia or osteoporosis in your family, there may or may not be benefits to taking birth control. And or it could be a lifestyle decision. Perhaps you are in a point in your life where you don't want to have a child, you don't want to be pregnant, but you definitely want to have a lot of intercourse, and maybe you have multiple partners. So birth control is something, when it comes to the hormonal piece, that you want to bring in. Now, remember, hormonal birth control doesn't protect against STDs. So I have to throw that in there that, condoms, whether it's female or male, are what you want to use to protect against STDs. And then there's all the different types of birth control if you're to choose a birth control. There are monophasic, biphasic, and triphasic. Mono meaning one drug, bi meaning two, triphasic meaning three. And then there's different periods like 21 days, 24 days. Some are continuous birth controls, injections, patches, rings. Birth control is a huge topic. But when it comes back to your hormones, essentially we have to look at you as an individual, your risk factors, your reproductive factors, whether you are over 35, a smoker, you might be at more risk for clots or have a history of heart disease. All of these things factor in. I was on birth control for a very long time. Part of it was lifestyle decisions, as well as the fact that the birth control did show some protectiveness against the ovarian cancer that comes with my breast cancer gene. I have a 45% chance of ovarian cancer in my lifetime. What happened when my body tried to die in 2018, and I say that not jokingly, I was literally on the floor wondering how I was going to get up and go through my day every day and take care of my child. When I was going through all of my testing and my micronutrients, we decided to pull birth control out. And what it had done is had driven up something called sex hormone binding globulin. So a sex hormone binding globulin runs around in your bloodstream, and it was binding all of the sex hormones. And I literally had no access to it. So I didn't have access to my pregnenolone, my progesterone, my DHEA, my testosterone. So I wasn't getting all of the energy, and what little DHEA I did have access to was being stolen by my adrenals to support all my stress. So birth control had to go for me. I'm in a position in life where I could afford to have another child. I'm not looking to have another child, so I chose other forms of birth control. But the hormones itself were doing a detriment to my system and my body. And I think there's a lot of stories out there where females in particular go to the doctor and they have questions about their birth control, and the doctor brushes them off or doesn't really address why the female may need to come off of this. Birth control can cause severe depression in some patients. It may not be for you. It can also help other patients with their mood. So it's a very complicated topic, as you can see. I'm going to keep it brief for Wellness Wednesday. I want to talk about birth control. What are your experiences? What are your questions? And if you want to send those over to me, I'm going to share them over the next few days or week as we get birth control questions and forums, chats, things going here at Wellness PharmD Consulting. So I hope you have a great Wellness Wednesday, and I'll talk to you soon. Bye.